This is a difficult disease. I mean, we all know that. It's the statistics are pretty overwhelming. And I just have to say, as I look out in the audience and I see many of the patients that I've known for many years, it's wonderful to see you here, and you all say it's wonderful to be here. So I think humor is important also to have as we go on this journey. So I'm going to talk about the patient resources and support systems. By no means is this comprehensive or inclusive, but it's websites that I know about that patients have shared with me. So if I have left your particular website out, it's not by intention, it's just that I'm not that familiar with it. So what you've all told me, and I'm here not because I've had pancreatic cancer, but you've been all very generous in sharing with me your experience. So what you've told me is that at first, when you get a diagnosis of pancreas cancer, you feel very alone. What have you done to deserve this? And there's a little bit of depression that comes along with this initially, and that I think this picture sort of highlights how you may initially feel alone, end of the boardwalk looking out into the ocean. It's not too sunny, a little bit chilly, but hopefully by the end of this, you'll feel like this. You'll feel very supported. Our patients and family members hopefully are in the center, embraced by their community of friends, family, and loved ones. So what I did is I abstracted some of the websites that I think are very helpful to show you that you're not alone in your journey with pancreatic cancer. So the first one is the Herzberg Foundation. I think we've heard a lot about that today. I was going to go on and talk about it. Two things I want to mention about the Herzberg that I don't think were mentioned or highlighted to the extent that they need to be is, one, they have Allison Miller, who's in the back of the room, who's a great resource to people who call in from all over the country looking to find out where they need to go in their local community to get help with their pancreas cancer. The other thing is that a lot of people, when they have this diagnosis, they run into financial problems. And so what do? Who can you borrow money from? Is there resources out there? You can contact Allison. She can connect you with Cancer Care, who then does an intake and has patient financial grants available that are funded through the Herzberg Foundation. Carolyn spoke about the Sims-Mann Center for Integrative Oncology. They partner with our center, which I'll talk about next. We're very lucky to have the Sims-Mann Center at UCLA. In particular, we use their psychological services a lot, as well as Carolyn. Aggie Herzberg and her foundation fund actually a dedicated counselor to our center, Tom Peer, and so he comes to our meetings, he learns about our patients, and he's available at the time of the initial consult and follow-up to make contact with our patients. And then there's, of course, us. The UCLA Center for Pancreatic Diseases. Our doctors are Dr. Reber, Hines, and Donahue, who are the surgeons. It's a multidisciplinary team approach to patient care. We have medical oncologists. You met Dr. Rosen today. We have interventional radiologists, interventional gastroenterologists, pathologists, radiologists, the social workers, and we all work together. We meet formally twice a week to talk about our patients, and informally several times a day. And we believe that that team approach actually has much better outcomes than if you were only being treated by one single discipline. I think Dr. Rosen talked about this, that sometimes, coming to a large medical center is not exactly your level of comfort. It can be pretty daunting, plus you have to pay for parking. No, we don't validate. So, there are wellness communities. I'm very familiar with the Santa Monica wellness community in particular, and they offer some of the same things that we offer at UCLA. They offer psychological counseling, nutritional counseling, mindfulness exercises. And then I just wanted to bring up, because a couple of years ago, Aggie did have the founder of the East-West Medicine Center at UCLA speak, and I did contact them. It's a great center. If you're interested in that integrative Eastern-Western medicine, it seems to me like there's a little bit of a waiting time to get in there. You can kind of jump ahead on that if you have your doctor make a direct referral to the center. And then this actually, I have to give credit to our patients, where they talk about, you know, when they say that they have Pancreas Center and their family, friends, church communities, school communities want to help, how do you get that organized? And there are websites online that help get that organized. In particular, the two that they have talked about to me are mycancercircle.net and then caringbridge.org, which also helps organize. But that one, what they talked about is you can journal on that and put it out to your immediate community. It is privacy protected, and then people can respond back to you, and it's just, I see a shaking head. They just said it was just very supportive, and they couldn't have done without it. So I think that that's a good one to look at. So let's talk about what your initial journey may look like. Now, as I look out, a lot of you know what this journey looks like, but for some of you who don't, initially you may not be feeling well. You can maybe have a little abdominal pain, appetite's not so great, you get full a little bit quicker than normal, and then all of a sudden one day you wake up and you're jaundiced, or you go out to the market and someone says to you, wow, what a tan you have. Or it's incidentally found. So we have many patients that didn't know they had a tumor in their pancreas. They were in an accident, had imaging done, or they were being surveilled for some other reason, and the tumor was identified that way. Then we have the diagnostic workup. That includes maybe the imaging, the ERCP, the EUS, which then leads you to go have your consultations. Those consultations, you know, we talked about that. It's medical oncology, surgical consultations. And then based on those specialists, you have a treatment plan that's put in place. And the treatment plan, Dr. Rosen identified some of that, is surgery with adjuvant chemotherapy or neoadjuvant chemotherapy plus surgery plus or minus chemotherapy after the surgical pathology has come back. Unfortunately, we have had some patients who have had neoadjuvant chemotherapy, had surgery, and their surgical pathology comes back and it's perfectly clean. That doesn't happen a lot, but it has happened, and they don't need to have chemotherapy. And so as you know, you look around the room and you'll see from that panel, then people go on from this treatment onto recovery, getting back to what they normally do, working, hiking, traveling, taking care of grandchildren, taking care of adult children. And that's recovery. And then you have follow-up. So the follow-up is the surveillance imaging that you have done, the biomarkers that are done, the CA19-9. And I know that this follow-up phase is really nice to be in, but whenever you call me up to set up the CT scan and get some blood work done, there's a lot of anxiety. And so at our center, what we try to do is to acknowledge that anxiety, get you scheduled as quickly as possible, and then as soon as the results from the imaging come in, we call you and let you know that hopefully everything is okay, because we don't want you to be in that anxious state. Not a good place to be. So because we talked about the statistics, we know that the cancer may come back. So what happens if you're out 22 months, you have a surveillance CT scan, some biomarkers done, and the cancers come back. Well, then you've got to, pull yourself up by the bootstraps, remobilize your support team. Some of the treatments that may be offered are, some chemotherapy, probably different chemotherapy than you first had, and plus minus radiation therapy. Do the things that make you feel good. So if Dr. Rosen says, hey, listen, I think we should try a new chemotherapeutic regimen, you can say, you know what, Dr. Rosen, I want to go on vacation for 2 weeks and then come back. And he'll probably say, you know what, that's fine. But, fill that space in your heart that what you want to do. If it's getting a massage, if it's doing acupressure, acupuncture, just do all those things. If unfortunately the chemotherapy isn't as effective as we want it to be and your disease progresses, then you might want to talk to getting a referral to hospice care. So preparing for the journey. I think we heard a lot of things today, words, and I just kind of wrote down some, and I just wanted to go over the meaning of some of these. So anastomosis is basically a new connection. They're just sewing two things together. They're really wonderful tailors, these surgeons. They know how to sew. A leak is a fistula. That's when this sewing of the two parts, the anastomosis, kind of just pulls apart a little bit. The pancreas tissue is very thin. It's like, think of a tissue paper and they're putting sutures in this tissue paper, so sometimes it can pull apart. So you can have a leak of the pancreatic juices, and that's a fistula. Downstage means to shrink. We talked about neoadjuvant chemotherapy. That's downstaging or trying to shrink the tumor. Oh, tumor, lesion, and mass. They're all the same thing. So sometimes I'll be on the phone with a patient and say, well, you have this mass. And they'll say, well, the doctor told me it was a lesion. It's all the same thing, more or less. It needs to come out or be treated. The ileus, Dr. Bennett Roth talked about an ileus. That just means that your intestines aren't working. So Chemo Brain. So I think I can describe Chemo Brain, not that I've ever had it, admittedly, but it's sort of like cotton candy in your head, and it occupies your space. So people will, you'll see in the next section, people need to write things down because they can't hold the date of their next appointment, or they can't remember what chemotherapy they're on. And it is what it is. It'll get better, and just, sort of enjoy it while it's happening and call it what it is, I think I was talking to this lady, and oh my goodness, it was a really interesting conversation. It kept going around and around. And finally, she just said, you have to excuse me, I have Chemo Brain. And, just getting it out there made her feel better. I understand what it means, and it's fine. So then you need to be your own advocate. At least I think you should be your own advocate. If you're so overwhelmed, or maybe that's not your personality, then identify someone, a friend, husband, wife, adult child, who can be your advocate. We know that this is very anxiety-provoking, so we suggest that you have a second set of ears. In our center, what we do when we have a consultation or a follow-up that we think that may be emotionally churning, we'll ask you to bring someone. If you can't, we'll have you bring your cell phone. We do conference calls while we're meeting with the patient. We'll also, if you want to record it, we allow you to record it. I mean, we're just very supportive of you being supportive in this journey. Again, listen to your body, reach out for support. A lot of us on the West Side, who don't want to have immunizations for our children, we're pretty type A kind of people. And so we think that, we can handle anything and everything. This is really big. This is really big. You're acutely faced with your mortality. I don't need to tell you that. You know that. And that this journey is made much, much easier by reaching out for support. Some of those websites that I showed you in the beginning, you can reach out to them. They offer support. And be good to yourself. If you want to go shopping, go shopping. And don't buy things on sale. You don't have to. You want to get that facial, get the facial. I want to just go back a little bit and tell you that at our center, we've been very fortunate to add another team member. And that team member you'll meet, usually not in the outpatient setting, but in the inpatient setting when you're an inpatient. And that's our nurse practitioner, Lauren D'Amato. She's here. Lauren. There's Lauren. And she's an excellent resource, excellent. She knows this disease. She's been a nurse practitioner. She graduated from UCLA. And she has added so much to our team and to our faculty. So she's another excellent resource. She does cover for me when I'm off. So sometimes if you call me or page me, you'll get Lauren, and she's just excellent. So I think organization is the key to success, especially on this journey. So whether you're technically competent and you can do it on your iPad or your computer, or if you're less technically competent like I am, you can, Dr. Reber's shaking his head. You can use a 3-ring binder. I walk around with a marble-covered notebook for reminding me what I need to do and who's called me. And so what you want to do, no matter how you do it, is you want to have headings with dividers. And the first thing that you do is when you come to see a doctor, whether it be at UCLA, over in Santa Monica, in your local community, is you want to make sure you know who they are, what their credentials are, and how to get in contact with them. So you ask them for their business card. And then when you go for your consultations, you want a report of that specific consultation. At UCLA now, there's a website where patients can go on and get access, immediate access to their health record, and you can print things off from that. I'm not sure that our clinic is live yet. I think in February our clinic is going live with that. But if not, you could ask one of us if we can email you or scan in it and send you by email the consultation report. Whenever you have imaging done, and hopefully this is a long journey, right? So there's lots of imaging. You want to get the reports of your imaging, and for us or for other centers, what's really important are the CDs. And no, CDs can't be faxed. Can I fax it? And at UCLA, we are just starting this new technology where CDs, images can be downloaded into our system. That's just brand new, and we haven't started it yet. But in general, what you want to do, especially if you don't know the capabilities of the center that you're going to or the doctor, you want to always ask for the CD. And then you can make a little jacket and put your CDs in your notebook. Procedures, ERCP is when you have a stent change or they want to look at ducts in your pancreas and bile, in your bile ducts. Endoscopic ultrasound, or EUS, that's a procedure that most of you have had, especially if you've gone on to have chemotherapy and not surgery. That's when they drop that tube down your throat, you're asleep. There's a little ultrasound machine on the end, and what they do is they also then put a needle in and get out some tissue. That's called the FNA, or the biopsy. And you want to get those reports, the FNA report. Sometimes at UCLA we'll ask you to get the slides, so you just contact the pathology department where you had your endoscopic ultrasound and FNA, and then UCLA, we like to sometimes review slides. Also, you want your surgical pathology. So that's when the specimen, the tumor, that part of the pancreas is taken out. At UCLA, it goes to our specialist, the pathologist. They slice and dice it, look at all these very thin slices to tell us about the cancer, about is it well, moderate, or poorly differentiated. They tell us about the lymph nodes involved, and about LVI, which is lymphovascular involvement, and perineural involvement. And Dr. Rosen talked about some of that. You always want to be able to have your labs, all right? Especially if you're coming back for a visit to see us to be evaluated about whether whether your tumor has shrunk. We'll ask you for the serial CA19-9s, which is that biomarker. A lot of our patients will graph it out for us, which is very helpful. But that gives us a piece of the puzzle about how well you're responding to chemotherapy and whether you should go on and have surgery. If you've been admitted to the hospital, sort of on this journey, you would always like to ask for the discharge summary, which just basically summarizes for you what has happened, why you came to the hospital, what happened while you were in the hospital, and what is the plan for when you go home. And then the chemotherapy treatment protocol. If in fact you go on to have chemotherapy, what chemotherapy are you receiving? So when you call me, and I say, do you know what your chemotherapy regimen is? You can say, hold on, let me get my binder, and then you tell me what it is, or you make a copy of it and you bring it to the consultation. So benefits of organizing your medical record. It's information at your fingertips. You own this. This is your journey. It's what's going on with your body. I think that it allays anxiety, because if you have it on hand when someone starts asking you, what about this or that, and you have a little chemo brain going on and you can't remember, it's all documented and you have it at your fingertips. Also, having done this for a number of years, when you have to go back retrospectively and start collecting medical information, it can be very time-consuming and pretty frustrating. A lot of hospitals don't have the person power to help move that along in an expeditious way. So if your appointment's on Thursday and you start trying to get this the Friday before your Thursday appointment, sometimes people have to cancel and reschedule because they don't have the necessary documentation. And I think it's, in a situation where you don't have a lot of control, it allows you a piece of control. And I think, when we talk about nutrition, that allows you some control and empowerment. And I think that really is an important piece to try to have when you go on this journey. So, they always ask me to speak, well, not always, but when they do ask me to speak, it's always last. And I just wonder why that is maybe because I'm from New York and I speak quickly and I can kind of make up the lost time. So, in conclusion, don't be an Eeyore, okay? I know you didn't ask for this. No one raised their hand to have pancreatic cancer. And if you need a day to be sad, you don't need my permission, but sure, go ahead and be sad. But you know what? We all know. Thanks for noticing, right? Isn't that what Eeyore says? So hopefully, if you can reach out for this support, the journey is easier with the help and support of your friends, family, neighbors, and of course, some humor. Thank you.